Is an inspirational gospel music also on Rainier
I
Avenue
see it now. Edward
We
Jackson.
give out free food each and every Saturday from 11 to 2. And so we want you to come on out and support us when we love on your community. And we also have a fish fry once a month. We want to raise funds, put back into the community. And so come on, support us. We need your love. And also, if you want to be connected with us, go to Rainier Avenue Radio World, to the website, Facebook, Instagram, and God is. And as God is got a website, we need your help, community. So come on out and get your free food each and every Saturday it is. And so we asking for donation, whatever you feel to give from your heart to the mind. And as we doing it right here for you, go to our website and touch love and give back. And so come on by 810 23rd Avenue, Rainier Avenue Radio World, your community radio station and inspiration of all the things we do in your community.
Hello, listener. What's important to you about what's going on in your community? Are you interested? Are you concerned? In any case, I invite you to tune into my show, Seattle Here and Now, on Rainier Avenue Radio World. Why? I will be covering a wide range of topics important to you and impacting the community. Each show will have a special guest or guests to share with you information on a variety of subjects that are happening here and now in Seattle. I promise I will work hard to make my show informative, interesting, and entertaining. Be sure to listen to Seattle Here and Now on Rainier Avenue Radio World.
Yo, what's good? It's D-Money, and you should definitely check out Fresh Juice every Wednesday, 9 to 11 Pacific, right on Rainier Avenue Radio.
With pint-sized Patron, P-Treasy to Don. Y'all be sure to clean your mirrors as we play brand new hip-hop and R&B from locals and worldwide.
It's ID Yourself, a.k.a. Malcolm Flex. Make sure you check out Fresh Juice every Wednesday, Pacific Standard Time from 9 to 11 p.m.
And to get those exclusive interviews that we be doing.
Sipping a brand new Fresh Juice every single week.
Yeah. Every Wednesday, 9 to 11, Rainier Avenue Radio. Yeah.
My name is Josephine, and I live in Renton, Washington. Even after getting COVID in 2020, I still did not want to have anything to do with the vaccination. There was much fear in the African American community. Before you do anything, pray. And make sure that you're praying to get the answer and not praying to get your answer. Reconsider, asking yourself why you are hesitant about getting it.
To learn more, please visit weconsiderwa.org.
You are listening to Rainier Avenue Radio World. Don't forget to log on www.rainieravenue radio.world.
Welcome to Rainier Avenue Radio World. It's me, Tony B. This is Friday. It is time for the impacts of the coronavirus on South Seattle and surrounding communities. A little later in the show, Delbert Richardson will be joining us, along with Devon Love, talk about what they've got going on. Yeah, but right now, James Lewis is going to be joining me right here. This has been 2 years, over 2 years. And for a lot of folks, that was 2 years of, it seemed like it took forever. And then now it just seems like it's just gone. But then I'm back. We've been hearing a lot more about the coronavirus lately. We've been once again getting information that seems to be conflicting. And we want to address that. And we'll continue to bring you these shows now that we started on March 20th of 2020. Actually, I think that was March 13th of 2020. Anyway, we've done over 220 shows talking about a number of different things that the coronavirus has impacted, along with the vaccines and the different variants and professionals in business and healthcare professionals, members of our community who own small businesses, folks who contracted coronavirus, folks who were impacted because family members had coronavirus. We've talked to folks who didn't believe it existed, folks who did not want the vaccine, and a number of, I remember at one point folks were complaining because early on people were going outside when we were told to stay inside. And we had that discussion. Again, we don't tell you necessarily what to think here. What we do is have the discussion so that you can discern and decide for yourself. I'm going to bring James on right now. James Lewis. James, how are you doing?
Doing well. How are you doing, Tony?
Well, under the circumstances, James, I'm doing fantastic. Good to have you on the program again.
Yeah, good to be here. Thanks for inviting me.
Well, I'm going to give people the nickel tour of your background. You're a medical epidemiologist, and you work on the COVID-19 healthcare system response for public health. But, you know, we've done this before. Tell us a little bit about yourself. Tell us a little bit about your background and why you chose to get into this particular work. And you know what? I'm going to say this, just for anyone who may not be aware, give us an update also on what an epidemiologist does, what that means, the work that you do.
Yeah, sure. Thanks. So I'm a physician, and I did my training in internal medicine. So that looks at, diseases all throughout the body. They can be primary care doctors. They usually will take care of people with more complicated medical conditions or a lot of medical conditions all at the same time. Then I went in and did special training in infectious disease. So learning about how to treat infections that people get. And while I was doing that, I realized I was really interested in looking at policies and patterns of disease in the community, looking at the population level rather than the individual level, which is what my training was focused on, early on, which was, taking care of individual patients. So I got into public health and really think of, public health medical epidemiologists as being kind of doctors for populations rather than doctors for individual people.
That's a good explanation. That's a good explanation. No, keep going. I just that was doctors for populations instead of just people. Yeah. Did you coin that phrase?
I hesitate to take credit for it. I could have heard it somewhere else, but I can't give credit to anyone in particular. So I'm sure somebody else has said it before.
Keep going. Sorry.
So what an epidemiologist does, I am a medical epidemiologist. So I have a medical background, and there are medical epidemiologists that have nursing backgrounds. I'm a physician, also veterinary backgrounds, and probably others that I'm not aware of, but generally they have some sort of clinical background. But then there are epidemiologists who don't necessarily have a clinical background. And what they do is they look at patterns of, diseases or injuries or, environmental contaminants, pollution, and the effects that those things have on larger populations. Mm-hmm. And so we have, for instance, a team of epidemiologists that put together the dashboards we have up on our website. So they get all of that data and they put it into figures that hopefully, everybody can see and understand to help understand what's going on in their community or their population. So that's kind of what epidemiologists do.
Would it be fair to say, or leaning in that direction, that what's going on before we do in regards to tracking these types of things?
Yeah, I think that's fair. I would say, we aim to get that information out as fast as possible for people so they can understand, but we do see the information first, and then we have to work to put it together in a way that, hopefully the most possible people can understand it. And also, sometimes we get the data in ahead of time and we look at it and we're not really sure what it means potentially. And so we have to do a little bit of work to understand what it means for ourselves first, because we don't want to put information out there that could cause more confusion or harm than good. But we do work our hardest to get it out as fast as possible in a way that everybody can understand, hopefully. Or that's the goal anyway.
So we're going to just get straight to this and see if you have an answer for this. Recently, Dr. Fauci said the pandemic is over. Then, like the very next day, he said the pandemic is not over.
Yeah, I mean, Dr. Fauci is much more experienced, intelligent, and respected person than me in general. So I don't want to put any words in Dr. Fauci's mouth, but my understanding of what happened I think he was really saying that the kind of explosive or the explosive pandemic stage where things were happening at a very rapid rate, things were changing at a very rapid rate, the impacts were very heavy on the community and the healthcare system, and that we've really moved away from that stage, but we certainly still have a pandemic. And here in Seattle, we're seeing increasing cases across our community, so the pandemic is certainly not over. And so I didn't hear his original interview and what the words were, but I do know that sometimes folks can be paraphrased and things in ways that maybe they didn't actually intend. So I'm going to assume that something like that happened, and that's my opinion. And yeah, folks can take from that what they would like, but I think that's probably what he intended, is that we're just kind of in a different phase of the pandemic, rather than and the worst part of it maybe is over, or at least heading towards being over, rather than the worst part is certainly over, because we now have access to vaccines and treatments and things that can really improve people's outcomes, and they won't get as sick as they would earlier in the pandemic. And that he wasn't truly intending to say that the pandemic was completely over.
Okay, and I'm not asking you to read Dr. Fauci's mind, but at the same time, those of us who are not doctors and depend on people like yourself, Dr. Fauci, for information, so that we can kind of figure out what our next move is going to be. You got to know that sounds confusing, because it does sound conflicting. Yes, there's this thing called context, but everybody doesn't have time to do a whole lot of research. And people know that, especially someone of the stature of Dr. Fauci knows that.
Absolutely.
And so it's just a weird place, because I think it was last week, we did a breaking news report. Dr. Duchin came on to tell us that we were moving from a low level to a medium level. Now, there were some things that went along with that. There wasn't an increase, or at least an increase in hospitalizations that was going to cause alarm. We had, just started removing masks. And I know for a lot of people, it felt like, hey, this is getting back to normal. Your interpretation of what that means in regards to safety for individuals. Now, of course, we have a population that includes a number of different folks. We have those who are under 5 who can't get vaccinated. We have those who are have pre-existing conditions, and our seniors folks who may be more susceptible to catching this. We have folks who are vaccinated now. We have folks who have had coronavirus. Folks who still aren't vaccinated, folks who are younger, who maybe have stronger systems to deal with this. We moved from a low level to a medium level. From your perspective, what does that mean? How do you look at that? Share with us your thoughts about what that looks like.
Yeah, I mean, there's no kind of magic switch that goes from low to medium, right? It's a number that was determined by the folks at the CDC, that once we got to this certain number of cases we're seeing every week per 100,000 population, that we would move from one label to another label. But was it that much different a week and a half ago when we were at 180 versus when we got to 200 this past weekend, or over 200, and now we're getting closer to 240, and that's cases per 100,000 people that live in Seattle per week. It's not all of a sudden that your safety, individual safety or risk, kind of ratchets up in a stepwise way. It's like your risk was here before last weekend, and now your risk is here after last weekend. That's not like that. It's more of a continual, gradual increasing of risk as the cases slowly start to increase, or sometimes they quickly increase, but this time it's been a little bit more slowly. Certainly it's more slow than it was during the Omicron peak back in January. So I would say, the individual risk of getting infected is slowly increasing, and we've crossed a threshold now to where, I think it's important to make people aware of, and just kind of center people's awareness on what's going on with the virus in the community. Again, for folks who are immunized, especially those who have received the recommended booster doses of vaccines, that's the most important thing they can do to reduce their risk. And those really do seem to give great protection against having, bad illness or severe illness from getting infected. And so those people can feel pretty confident that, they won't personally get very sick if they do get exposed and infected with the virus.
You're listening to Rainier Avenue Radio, our special broadcast of the impacts of the coronavirus on South Seattle and surrounding communities. My guest is Dr. James Lewis. One of the things, I guess you can go to the dashboard and you can check this out as well, in regards to what we're seeing as spikes. These spikes are, my understanding, in our communities, there are geographic areas that are spiking. And I'm going to get to that in a second here. But my question before that is should we have anticipated that once we took the masks off, that we would see a rise in cases? Should we have anticipated that?
Yeah, I think, anytime you take away a measure that's reducing your risk of transmitting if you are infected or getting infected, if you're exposed, then you can expect to see an increase. I think it's really hard to predict, if that increase is going to be big or small, right? So, could we have predicted that removing the mask would have resulted in us crossing this threshold into medium? I don't necessarily know. It could have been just as likely, given how many people are vaccinated here in King County, that it could have risen a little bit, but never quite gotten to that medium and then gone back down. But certainly, if we reduce mitigation measures, then you can expect to see increases in cases.
So where does an epidemiologist come into play to address what I just talked about, where we say in certain geographic areas, in certain communities, we see a spike? What is your role in that? Or do you have a role in that?
Yeah, I think, we definitely pay attention to that and look for those kind of disproportionate impacts in different areas, right? So certain places or peoples being impacted higher or more heavily than others. And so we look for that. And then the big question we ask ourselves when we look for that is, who are the people who live in those places, right? And who makes up the majority or a bulk of the population that live in those areas, and do they have the resources they need to get treatment or get tested, and or get vaccinated? And if the answer is no, like it was for most of the pandemic, whenever South Seattle and South King County were disproportionately impacted by the pandemic, then we use that information to try to get resources to those areas and to the people who historically haven't been able to have access to that. So that's where the epidemiologists come in, and that's why it's kind of like I was saying earlier, it's like being a doctor for populations, because you're trying to get these really medical resources and resources to maintain your health to those areas that don't have good access to that.
And I know this might be kind of a difficult question to answer, but so where do you fit into this as far as saying, hey, look, this is what we're seeing, and because this is in certain communities or geographic areas, that could impact certain folks based off of their social, economic status, ethnicity, race. What I'm getting to is, how loud is your voice in the room in order to get the type of action that you're talking about when you're talking about getting resources to a community?
I mean, it's a kind of a hard question to answer, for every situation. I would say, during COVID, our voice has been very loud. We were able to make those things happen. We got vaccination sites and testing sites set up in South King County, in close to South Seattle, that didn't exist before. And that was a lot of people helped make that happen, but public health played a large role and the epidemiology team played a large role in making that happen. Along the same lines, for treatment, the Department of Health, the State Department of Health, manages kind of getting the treatment from the federal government. So far, all the treatments are subsidized by the federal government. And then they ask the local health departments, like Seattle, Public Health Seattle and King County, where should we make sure we get these treatments to? And we provide active feedback into that. So I think, during COVID, we've had a lot of say in that. And then for other health situations, it kind of depends on the specific situation you're talking about. But I would say we always are a large stakeholder and have a voice, and it just kind of, probably varies to some degree from situation to situation, if that makes sense.
Yeah. So I'm going to ask you to look into your crystal ball. And I'm going to say your crystal ball is a little less foggy than my crystal ball. So now we've got the weather changing. Hopefully, I guess this was the coldest April in like umpteen years in Seattle or something like that. But you know what? So people want to get out. People want to mingle. We've got summer coming up. What do you see in your crystal ball, again, taking into consideration now that, yes, we do have vaccines, we do have other treatments available, but bypassing the process where you have to have your voice be the loudest voice, or try to get your voice to be the loudest voice in the room. Right now, you can talk directly to our listeners, those who are watching on some of our formats, listening on our formats. What do you see coming up for this spring and fall? Again, we talked about, okay, well, yeah, maybe it makes sense that if you take the masks off, there's going to be, an uptick. What can you share with our communities right now about what we should anticipate, again, as the weather changes this coming summer and as we get into the last stages of spring?
Yeah, it's a great question. And again, I think you framed it well as a crystal ball, because I think the only constant thing about COVID has been being unpredictable, I think. But I think, unfortunately, we can expect cases to continue to increase here in Seattle for at least another couple weeks, if not 3 to 4 weeks. Initially, this uptick in cases we were mostly seeing in younger folks, so between the ages of, say, 18 to about 35, 36. That now, unfortunately, has spilled over, which is not surprising. We've seen this pattern in previous waves into the other age groups. So now we're seeing cases increase in all of our age groups. Maybe a little bit of a decrease in the 18 to 25-year-olds. So they may have peaked already, but all of the other age groups are increasing. So I think and those increased before they peaked for about 4 weeks or so, 3 or 4 weeks. So we can probably expect the other age groups to see an increase on something close to that time scale. At this point, it doesn't seem like we're going to have anything, close to the number of cases we saw during the Omicron wave. But it could be that we had, that peak back in January, but it could be close to the Delta wave that we saw last fall, potentially. But hopefully, given we've done a great job getting, vaccines out there, and again, that's the most important thing people can do to improve their safety is to get vaccinated and get the recommended booster doses. Hopefully, we won't see an increase in hospitalizations during this wave. And so far, we've seen a minimal increase in hospitalizations. And hopefully that stays true. And that is what the folks over in New York City saw with this, with their most recent wave, that they're kind of ahead of us essentially on. They didn't see a huge increase in hospitalizations, so that's good. I think once people start heading outside more and spending more time outside and interacting outside, that will actually be helpful, hopefully, for the transmission, although we did see an increase during the summer last year. I'm sorry, in 2020. Forget, like you were saying, it's been a long couple of years. It's hard to keep track of which years. So that's not a guarantee that we won't see increasing cases when people go outside, but in general, interacting outside or in really well ventilated spaces is going to be lower risk for transmission, just because the virus won't be as concentrated in the air where you are, because it's easily dispersed out into the environment when the ventilation is better, and so your exposure won't be as intense. So hopefully we'll see this peak at a lower level in the next few weeks, come back down. And then I think we can expect, I think it's reasonable to expect that once we kind of level out, hopefully we won't see another increase in cases. I think we will see another increase in cases after that, but hopefully not until the fall. But it's certainly possible we could see another rise over the summer.
We talked earlier again about, it's been 2 years. Over the course of this 2 years, isolation, government mistrust, systemic racism, all of these things played a role in folks not getting vaccinated and tested for other things. And not that there still weren't things that we don't know that were on the horizon or maybe on the horizon. So my point to get to this question, is there anything that we should be aware of that we don't know about yet that maybe isn't even coronavirus? But again, something that is out there that is an epidemiologist, you saying, hey, we're seeing this, and maybe it's because folks haven't been protected against it. You know what I'm trying to get at. Is there something out there other than coronavirus that you see? We've heard about, kids who went back to school in the fall and hadn't been vaccinated for some things that we had been vaccinated for years, whooping cough, different stuff like that. Anything out there on the horizon, Dr. Lewis, that you see that we should be aware of?
Well, I do think, there's a couple of things. We are continuing to see a bit of an increase in STDs. That's another thing that people should be more aware of. Seemed like people weren't getting perhaps as much testing and treatment for STDs during the pandemic. And then the big one is that you already brought up is childhood vaccinations. So childhood and other routine vaccinations for other diseases like whooping cough. Big one is measles. We're seeing a big increase in measles cases. It's still relatively low numbers, total numbers, but much higher, or about twice as many cases as we've seen in the past. And that likely has to do with folks skipping those childhood or delaying those childhood vaccinations for their kids. And so that could certainly, we could start to see more and more of that as things go on if folks don't go back and catch up with those vaccinations. So strongly encourage everybody to stay up to date on all of their vaccinations to prevent that. As far as other things that, might cause pandemics or epidemics or increases of cases, that I don't think there's anything that we're looking at imminently that could potentially cause it, like another serious flu or, some other coronavirus or something like that. At least not that I'm aware of. But as global warming increases, we're going to start seeing more spillover of viruses from other, some animals to humans. And whenever that increases, we're going to increase our risk of another pandemic potentially, because that's likely what happened here with the coronavirus, is that the virus was spilled over from an animal reservoir, and then people were able to transmit it to one another. So there is work being done and planning being done to prepare for that possibility in the future. But hopefully that will be, hopefully never. But if it is going to happen, hopefully it will be many years away. But it's hard to predict.
Dr. Lewis, it seems like we just got started, and we're not only out of time, we're probably going to be a little bit over time. But I do want to give you an opportunity for final words here. If there's anything that you want to share with our listening, viewing audiences. And I've been firing questions at you, so I'm going to give you a little room right here to get your message out to folks that you'd like to share?
Yeah, there's a couple of things that I wanted to mention. So number one, again, just really going back to getting vaccinated, getting boosted. Those are really the best things you can do to protect yourself. Also, continue social distance and mask, given we're seeing an increase in cases. And then also getting tested. So if you think you might have been exposed or you have symptoms that could be coronavirus, get tested. And now we actually have a federal program called the Test to Treat program that I wanted to put out there. Anyone can go to covid.gov, so covid.gov. And there's a link on there on the right side to a Test to Treat page, Test to Treat locator. And if you type, you can type in the search bar on the left-hand side your address or just Seattle. And if you do that, you pull up a lot of locations that can either fill a prescription from your provider for treatment for COVID, or there's actually 5 locations in Seattle itself where you can go and get tested and get treatment right away. And so you can find those addresses by going to that website. And so I want to make sure people know about that. And one big important thing to know about that is treatment has to be given within 5 days of symptom onset. So it's important to get tested quickly and get that treatment quickly because you won't be able to get the treatment if you are more than 5 days since your symptoms started from COVID. So that was one thing I wanted to make sure people knew about, especially if you're maybe at high risk for getting really sick from COVID. So that's if you have any underlying conditions like lung diseases or heart diseases, diabetes, things like that, you really want to make a plan to get tested and treated if you think you might be exposed or have symptoms of COVID-19, even if you're vaccinated.
Hey, Dr. Lewis, it's always a pleasure, and I always appreciate you coming on and participating in frank, honest conversation and the benefit of our communities. Coming up next, Devon Love. That's a pretty cool name. Do you wish that was your name? Anyway, Devon Love will be joining us. You can see on the screen if you're watching, if you're listening, the Equity and Community Engagement Manager at Public Health Seattle and King County will be coming on. She'll be joined by Delbert Richardson, who's the founder of the Unspoken Truths Traveling Museum. Why are they both on here at the same time? Well, there's an event coming up on April 30th, and we're going to talk about it and see why this combination is on the show today, right here on Rainier Avenue Radio .world. We'll be back in about 3 minutes.
This is Paul Pearson, host of Star Time. And when I'm not meeting Mrs. Jones in that cafe for a chat and nothing else, I'm listening to Rainier Avenue Radio .world.
You probably have questions about COVID vaccines. Here are some answers about how they're being made.
How are COVID vaccines being produced faster?
Usually, vaccine testing and production are separate steps. But because of the pandemic, vaccines are being developed on parallel tracks. So both steps are happening just at the same time.
How are the vaccines being tested?
Right now, several different COVID vaccines are in testing. Each go through multiple clinical trials with up to thousands of volunteers.
How do vaccines get approved?
Not all COVID vaccine versions will make it to the final stages of testing and approval. Produced vaccines that do not pass clinical trials will be destroyed. But for those that do pass, a team of medical experts will examine test results and possible side effects. If the vaccine is effective and safe, it gets approved and gets to you. Go to covidvaccinewa.org to learn more. A message from the state of Washington.
Women are not an homogenous group. We face discrimination differently depending on factors such as ethnicity, age, socioeconomic status, and more.
Rainier Avenue Radio is proud to amplify women's voices.
They are the experts of their own lives, initiating conversations within their community about challenges they face, the solutions they're working on, and the opportunities they see.
Please join us this Sunday from 2 to 5 for Women's Voices on Air. We know our challenges. We are the experts of our lives.
We are master multitaskers, prioritizing our family, friends, and our faith above our own needs.
Our needs and voices are too often overlooked.
Please join us this Sunday from 2 to 5 p.m. for Women's Voices on Air.
we'd tell our stories in our own way.
This is Big Poppy, host of Jazz from the Cabinets. Join me each week for a listening tour of the first century of jazz, an eclectic mix of Dixieland, big band, cool jazz, bebop, contemporary jazz, world jazz, all jazz in all forms. That's Jazz from the Cabinets with Big Poppy on Rainier Avenue Radio, streaming worldwide on RainierAvenueRadio.world.
Seattle band The Night Cry will be volunteering at the West Seattle Junction Beautification Project on Saturday, May 21st from noon to 2 p.m. as part of One Seattle Day of Service.
Would you like to see when your favorite Rainier Avenue Radio show comes on? Check out our show schedule, updated weekly at RainierAvenueRadio.world.
Welcome back to Rainier Avenue Radio.world. This is the impacts of the coronavirus on South Seattle and surrounding communities. It's me, your host, Tony B. We just had a conversation with Dr. James Lewis, epidemiologist. Again, they study I hate to call them trends, but things that are happening with diseases in our community, so that information can be shared to make us more aware if something is impacting in a particular community. And that's what we've done over the course of this past 2 years, is make sure unashamedly that we keep our communities informed about what's going on and what's taking place. Because ultimately, at the end of the day, the communities that we live in catch the hell of these things, of this virus. While they're trying to figure out what's going on, we're catching the hell. So it was great to have Dr. Lewis on and share with us what he thought and what he sees in regards to what we can expect coming up this late spring and also in the summer, and that's an increase and an uptick in the cases of coronavirus. And it's been 2 years, 2 long years, and then bam, all of a sudden it seemed like it was done. Mask came off and everybody was pretty happy about it, but we're still here. Joining me on the I'm going to bring Devon on first. Devon, how are you doing, Devon?
You know, I am doing very well, Tony. How about yourself?
Under the circumstances, I'm doing fantastic. I'm bringing you on because Dr. Richardson, I haven't even had the chance to talk to him for a while, so I'm gonna say hello to him when I bring him on the air. I get down. I don't know if you listen to the show or not, but you know, it's an opportunity to catch up. Your name is so. I'm getting in your Kool-Aid though, right now, a little bit, because your name is so right. You worked in early education, is that correct?
I did do some work in early education. I've been with the county for about 7 years and did a lot of early learning work with the Best Starts for Kids initiative previous to the current role that I'm in. Yeah,
I'm very vested in early education, unless there's 2 Devon Loves running around.
Not that I know of.
Tell us your role. Since you switched roles, now that I've talked about that, now your role that you play with Public Health Seattle King County.
Yeah, so I am an equity and community engagement manager, and this is a role that was newly created last year. I started in almost a year ago, about July of 2021. And it was part of an equity team that we have internally with our Community Health Services Division with Public Health Seattle and King County. We had this equity team and had decided that our response to the county's declaration of racism as a public health crisis was that we wanted to focus in the Black community. And it made sense to hire someone who would really be on the ground doing the work of working to improve relationships, build partnerships, find ways to support what the community is asking for. I'm in that role, and I'm very happy to be able to stand in and be that representative, not only for the county, but for the community when it comes to providing resources and servicing needs.
When I was talking to Dr. Lewis, and I don't know how much of that conversation you caught, Devon, one of the things that we were talking about over the course of the 2 years was the fact that, the isolation, the systemic racism, health disparities. These were things that we knew were going to impact Black communities and communities of color.
Absolutely.
And in addition to that, vaccine hesitancy for, again, a number of reasons that I don't mind bringing up again, but we've talked about before. But in addition to that, for an epidemiologist, they look in various communities to see where there's spikes and there's rises, and that information I think is pretty critical in order for us to know which communities are being impacted and affected. So for you, in this role that you have right now, where do you position yourself when it comes to saying, okay, this is very nuanced and it's very complex, but at the same time, communities are more affected because it still doesn't make sense. The same thing is happening now. We went from low to medium. And some of the same communities that were impacted initially are the ones that are showing the uptick from low to medium. What is your role in that? Do you work in that area? Is it even important to you?
So it's very important to me. My role isn't completely surrounded by it, but a lot of it does impact the work that I'm doing. So really, it's kind of interesting that early on you brought up the work that I did in early learning, because it was based on partners that I had worked with in that previous role that got me into the position that I'm serving in now. So I have to say, today I actually took a break to come and give this interview to you. I'm doing an event in Skyway for the Olajuwon Hands Community Family Reunion, and we're providing vaccines in Skyway. Last year at this time, we did that and were able to vaccinate over 200 people in the area. They had not had access to vaccines prior to that time. So it really is about creating and responding to what one community is asking for and providing that access. Where I am in Skyway is a transportation deficit area. So they didn't have the ability to get down the hill or to get to another area to really access those vaccines. So when a community partner said, hey, this is something that we're hearing about, is there a way to make it happen? We really did that. So my role is really about stepping in and responding when community says, hey, this is what we're seeing and what we're hearing. Now, I'm one person, so I can't be everywhere at all times. So I've formed some committees that in some smaller partner groups that are meeting and really do have their ear on the ground and can help identify where those needs and wants are, so that I can pull together resources that we have from the county to make sure that we're responding and able to help people access what they're really interested in.
All right, we're going to get into the conversation about April 30th. I just wanted to chat with you a little bit.
Yeah.
Let the people know who you were. I'm going to bring Dr. Richardson on right now, and the founder of the Unspoken Truths Traveling Museum, Dr. Delbert Richardson. And how you doing, sir?
Tony B. Hey, my sister, how you doing?
Hello.
Under the
I'm doing great. And Tony, thanks for calling me doctor. And we get a chance to support each other in how we see and feel about them. Just so y'all know, I don't have an official DR, but I have a community DR, and I receive that with love.
Yes. And you. I was talking about the beautiful name, I think, Devon Love. So what would Dr. Richardson? What if I said Booney? What would that? People say, what is he talking about? What would that name mean to you?
Tony, see, so we in the kitchen now, right? That's what we do, right? So Booney is my nickname. A lot of people don't even know that. And when I hear that name, that means you've been knowing me for a grip. And I tell people like Tony and other people, I don't matter to me what circle you in. with the president, with the governor, it don't matter. You can call me Booney because that's who I am.
Well, first of all, I have to do this because I haven't been able to do it in so long. And within the time that I've last been able to tell you, you've received so many awards and accommodations. And I remember, the length of time that you've been working on the Unspoken Truths Museum and your sense of urgency in making sure you shared this information with our community. And got the word out to our community, and the legwork that you put in and the time that you put in, often at no fee, just to make sure that we had access to history, that everyone had access to history. So, bruh, congratulations, man. Congratulations.
Thank you, brother. Yes. And, I appreciate that because I'm a self-taught educator. I didn't learn any of what I teach in schools. Because the reality is, when I went to public schools, there was no Black History Month for us to at least have a day or a month of celebration of who we are. So much love and appreciation for the acknowledgement.
Having said that, for anyone who may be unfamiliar, tell us about the Unspoken Truths Museum and Traveling Museum.
Thank you. It's a national award-winning traveling museum.
Yes, it is.
And I must throw that in here because I think it's important that people understand that it has been valued, not just in the state of Washington, but nationally as well. So, I have a traveling museum, but I call it a multi-sensory interdisciplinary pedagogy or curriculum. What does that mean? It means that I have a hands-on museum. I use authentic artifacts, which are primary resources. I use storyboards, and I'm a storyteller. I operate from this belief that our children learn quicker and faster kinesthetically. So you can touch the artifacts that are in the museum, which is broken up into 4 sections. First section is Mother Africa. We talk about the amazing accomplishments of a people from the African continent in the areas of STEAM, science, technology, engineering, art, and math. Then we have American chattel slavery. I teach about the enslavement period. I don't teach slavery. I teach about the enslavement period because words are important. I have authentic slave shackles and branding irons. The third section is called the Jim Crow era. I don't teach civil rights. I teach the racial caste system that was developed around this belief based on the social construct of race, white being the best and Black being the worst in terms of colorization. And the fourth, and probably one of the most important sections, is called Still We Rise. And it focuses on Black inventions and innovations, and have about a 40-foot table of everyday items that somebody looks like me and you and Sister Love have invented, patented, or have improved upon.
All right, my man. Devon, I'll start with you. We have an event. I've just touched on it. I haven't really shared what that is. Coming up April 30th. Tell us what's going on.
Yes. So Saturday, April 30th from 10 a.m. to 2 p.m. at the Rainier Beach Community Center, we will have our Every Month is Black History Month event. We are doing this event because it was really important to us after having Delbert come and give a presentation for our internal staff that we continue to spread the knowledge and actually also offer an opportunity, a very special opportunity for people to walk through and do all of those really good things that Delbert just mentioned with his museum. So that chance to have hands-on learning was really important to us, and we wanted to extend that to the community. We focused on it being Every Month is Black History Month because we know that Black history is American history, and it's important for all of us to have that knowledge and that understanding and to share that widely and broadly. So it's really important that we bring that there. So while we have the Unspoken Truths Museum that will be at Rainier Beach, we're also bringing in some very important health screenings. So we'll have glucose, cholesterol, blood pressure screenings and checks there, HIV testing.
I'm gonna stop you for a second.
Yeah.
And I'm gonna say what I said one more again. because you said some things that for a lot of folks, they go by really quickly and they don't think about it until it's either too late or, you know what I'm saying? These things become chronic illnesses. So one more again on that bias.
Yes.
What we're going to be doing, because these are important things. And if you're not thinking about glucose and other things, anyway, run that
Yep.
by again.
Yes, yes, yes. So we have a community partner who is coming out that will provide cholesterol, glucose, that's your blood sugar, and blood pressure screenings and checks for anyone who is 18 and over that wants to have those items checked. It's really important.
I'm stopping you once again. If you don't take care of those things, you can die.
Yes. Yes.
From the impact
yes.
they have.
It's really important to know your
Yes.
numbers.
Yes.
It's really important to know your numbers. And this is your free opportunity to do that. So come on out and get those items tested, get some knowledge and education, some resources about what you can do once you find out where your numbers are to keep them in the normal range, to lower them if they're perhaps elevated. But just to have that education is really important to do. We're also providing HIV testing, and we'll have COVID vaccines there. And in case you need it, we're going to have a mammogram on site. So there's opportunity to get your mammogram screenings as well. We have a few slots left in the afternoon, and it's just a great opportunity to come through and just experience all of the wealth of resources that will be at the community center that day, and just get as many checkups as you can.
Do you have to register in advance for the mammogram screenings?
Yes, you should register in advance for the mammogram screenings. And I do not have the number right handy, but I will find it for you, and I can give that to you in just a moment.
Okay. Well, I'm going to give you I'm going to give you some time to look for that, and I'm going to flap my gums for a minute here, because you talked about mammogram screenings, and over the last long 2 years, that finally, hopefully, we're coming to some sort of conclusion on that. Screenings were down for breast cancer, in particular for cancers that impacted women. And if you don't get tested, the best way to survive is to get tested early. And so those screenings were down as well during the COVID time. And of course, it was Black women are the ones who are, again, going to catch the hell from that we'll find out about. So I'm just encouraging people to do those screenings. And while you look for that information, I'm going to ask Dr. Richardson, why did you choose to get involved with this particular event that takes place on the 30th?
Well, Tony B, I'm so glad you asked me that, because public health is so critically important for Black people. You know, Sister Love was talking about glucose and high blood pressure. You know, my work,
the silent killers.
Yes. My work is primarily geared around identity development and self-actualization, meaning how do we create spaces primarily for pre-K to 12th grade Black and children of color to feel good about themselves. But when we start looking at health disparities, the thing that I don't think a lot of us are aware of is intergenerational trauma and historical trauma. There's this term called epigenetics that really has became a buzzword, which we've known for a long time, that trauma can be passed down through the genes. So if we're not aware of the fact that we as human beings dump cortisol all day and night, when in essence, fight or flight is the mechanism by which animals dump cortisol. So when they get hypervigilant, they dump cortisol. When they calm down, it stops. Because of racism and oppressive systems and structures, we as Black people, unfortunately, are dumping cortisol every single day, which is not healthy. So there's these things that the museum, if given an opportunity, will create a level of awareness, curiosity, critical inquiry, which will lead to some discoveries like Ms. Love is sharing. We must want to make our own personal health the #1 priority.
All right, I'm gonna go back to Devon here, but Dr. Richardson, I'm gonna say this I'm gonna say Booney. Man, I don't have my thesaurus with me, brother. Take it easy on me. You are throwing this information. I love you, bro. Just great, man. I really appreciate you and all you're doing. Devon, I think we were at mammogram screenings and information for folks. Because this needs to be done. You need to register in advance.
So I do know that there are walk-in opportunities.
Okay.
So we have a couple of morning slots. I think they're around 11 a.m. where people can walk in, and then some afternoon slots. There's about 4 available between the hours of 1 and 2:30 or so. So those are the times that are available to have people come on in.
Okay. Man, this time is going by really, really quickly. Let's do this one more time, Devon. So we've talked about a lot of things, and this is the reason why we're here again. April 30th. Again, share with us the importance of this day, why you're doing this day, what's going to be taking place, why folks should come out, where it's going to be, what time, the 411 on all this information.
So April 30th, 2022 at the Rainier Beach Community Center from 10 a.m. to 2 p.m. We'll have a special opportunity to view the Unspoken Truths American History Traveling Museum, featuring our very own Dr. Delbert Richardson. And then we also have a variety of health screenings that will take place that day. Really important to know your numbers. Come out and have your glucose, your blood sugar, that is, your cholesterol, your blood pressure checked. There's also an opportunity to get an HIV test if you need something like that, as well as COVID vaccines for 5 and up. So there'll be boosters there, but there's also the opportunity for anyone 5 and up to get their first or second dose of the COVID vaccine.
And that information, one more again, to register for the mammograms?
So to get the mammograms, you can walk on up. You can also go to our kingcounty.gov website, and you'll find us under the access and outreach information. And that's where you can find out about any mammograms that we're doing in the area.
All right, you are listening to Rainier Avenue Radio World. It's me, your host, Tony B. This is our special impacts of the coronavirus on South Seattle and surrounding communities broadcast that we started doing on March 13th of 2020. Here we are a couple years later. Wow, this time went by really fast, which is probably my fault because I spent some time talking to y'all. But you certainly took advantage of the opportunity to share incredible, vital information with our communities. And I want to give you both the opportunity here to share any final words, thoughts about whatever you want to share with our audience. Dr. Richardson, I'm going to talk to you. You speak as frankly, plainly as you want to, and I'm going to bring out my thesaurus so I can make sure I keep up with you.
No, I'm going to make it real simple. So I am grateful for the opportunity to work with Sister Love in the King County because I think healthy collaborations are so important. And, you know, these tests that they're doing and these services they're offering are so important for our community, but it's also important for our community because people that look like us are providing the service. Historically, the relationship that Black people have with the medical community is not a healthy relationship. So the goal for me, hopefully, is Black folks primarily will come down and feel comfortable enough to allow Devon Love and her amazing people to help them help themselves in regards to their public health.
And Devon.
Yes, I just want to say, please, please, please come out. This is an opportunity for our community, for our Black community to learn, to help themselves, as Delbert said, to really have access to all of the resources that we can provide. I did get the number for the mammogram, so if you want to call and have an appointment set up for you, that number is 1-800-756-5437. But there's still lots of opportunity for walk-ups, so please, please, please come out. There'll be food, there'll be joy. We're just planning for it to be a fabulous and very eventful day. Please, please, please come out and join us.
All right, really quickly before I say goodbye. This is a little off topic, but not really off topic. The Delbert, what do you think about that Minnesota-Memphis series?
I can't wait. Let me say this. Devon Love's team has labeled tomorrow as a public health festival.
Yeah.
Language is so important, right? So she's talking about fun, talking about Black joy, talking about community. Let's come out and let's love on each other in public, which we haven't had a chance to do in almost 2 years.
All right. And, I'm going to throw out one more thing here that may not seem like it's connected, but the opportunity to interview Kathy Sledge yesterday, the signature voice of Sister Sledge, and just a remarkable background and information. They'll be in town for a few days here at Jazz Alley. I just really enjoyed that conversation with her. So if you think that her story started at We Are Family, you're missing out on a whole lot. Go back and check out that interview on Rainier Avenue Radio.world. Just a wonderful person. And yeah, I'm just, yeah. Again, shameless self-promotion for Rainier Avenue Radio too.
Tony, we love you, bro.
Well, thank you both for joining me here on. Anything else anybody want to say before we go?
I do have one more thing. I just wanted to say there is a very special incentive for youth to come out. We're giving youth gift cards to Amazon to come and view Delbert's museum. So please, any youth 18 and younger that want to come out can come by, get some knowledge and get some maybe pocket cash to spend on some of those lovely things that you might have a wondering for. So everyone is welcome, but please, 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 again, come out and get your knowledge on, get your health checked and be with us. Yeah.
All right. Thanks to both of you, Devon. I guess I broke you in on interviewing with me.
It's been a pleasure, Tony B. It's been an absolute pleasure.
That's it. That's all the time I have. That's going to do it for the kid. It's me, Tony B. This has been the impacts of the coronavirus on South Seattle and surrounding communities. Special thanks again to my guests, Devon Love and Dr. Delbert Richardson. Check them out April 30th, Rainier Community Center. Remember, whether
Rainier Beach Community Center.
I said Rainier Beach, right?
It's all good.
Oh, what did I say?
Rainier.
Oh, okay. Well, that's Rainier because I grew up around Rainier. I played for Rainier 89ers. I'm saying I'm doing too much now. All right, Rainier Beach Community Center. That's it. I'm done. Remember, whether you believe you can or whether you believe you can't, you are probably right. I'm out. Peace.
Bye.